Hello everyone and welcome back. So today this is our video number 3 where we will be discussing Accuro EMR, appointment scheduling, and the day sheet. So in summary, from video number 2, we discussed the patient registration screen, which is what we see here. We see that from the patient status bar, we have patient John Smith, December 9th, 1976. He is a 43-year-old male with the following OHIP card number and cell phone number. So we just registered John Smith. And so now we need to book him an appointment. So therefore we proceed to the scheduler. There are many things I'd like to discuss with you about the scheduling. Just about the scheduling screen, there are many things that we can do and customize it to our doctors, to our facility, to the way the MOAs prefer to book appointments. The first thing I wanted to mention in the screen is here we have the patient info box. Now, since I had just registered John Smith into our database, it automatically comes here as the patient of choice when we want to book the appointment. So very easily, let's just say a scenario where I had just, John Smith, for example, called the office, I had registered him, and now I need to book him an appointment. When I press scheduler, it automatically comes into this patient box, and all of his information is there. Again, we have his name, the patient Smith, John, and of course, in any medical setting, we always refer to the patient's last name, first name. So patient's last name is always searched with a comma and then the first name. So we have John Smith here, all of his demographic information, as well as the provider that is dealing with Mr. John Smith. So when we need to book an appointment, it's very simple. We just click on this white area and we drag over to whatever time that we need to book John Smith. Now, as we can see, we have the times on the left-hand side right here. Now, I'm just going to minimize this panel here so we can better see the times. The times, it depends on how your office is customized, meaning when they are open, what time they close. As a default setting, Accuro has 8 a.m. to 4:45 when the last booking can occur. However, you can customize this however you prefer for your clinic. Now, if you take a look, every time has one bar. So we see 8 a.m., there's one yellow bar there, 8:15, there's another bar, so on and so forth. Now, each bar represents a time slot, a 15-minute time slot, and that is the minimum time that we can book an appointment. So if a patient requires half an hour, 30-minute appointment, therefore we would be booking 2 time slots. Okay, so please, it's a little bit tricky, but keep in mind that each one is 15 minutes. Many students, when they book 2, which we have here right now, the blue and the yellow that I have clicked on, it looks like it's only up to 8:15. Therefore, it's only a 15-minute appointment, but that is incorrect. It is actually a half an hour appointment. It goes from 8 to 8:15, 8:15 to 8:30. So this is actually a 30-minute appointment and not 15. So the rule of thumb that I like to tell students is that 1 bar equals 15 minutes. Okay, so if you require a 30-minute appointment, you would have 2 bars that are highlighted. Next thing I like to review is there's a calendar here where we can go to a particular day, we can go to a particular month and a particular year. At the bottom, this is also something that I appreciate Accuro for, is that we can just hit today and it will show today's schedule. We can look at 1 month previous 1 week, 1 day, and we can also go forward 1 month, 1 week, or 1 day. And it also shows the current date, which is Sunday, November 22nd, 2020. Now, I am the provider, so it has my name right here. Santa Zargar is the doctor at this office. Now, there might be multiple doctors that you will be serving or you'll be working for. And so at this clinic, we only have the one doctor. If we have multiple doctors, all you have to do is right click and you will see providers. You will see many options here, which we will go through, but one of them will be providers. You can pick all of these providers that we have at our office. I have only checked off Sana Zargar, but let's say there is also Dina. Dina is also a doctor. Therefore, now we have a schedule for Sana as well as Dina. And the zeros here mean there are 0 bookings thus far. Now let's just go back and right click and remove this doctor. So we're back at the 1 doctor. Another thing that we can change, and depending on the preference of the office, is that you can apply a template. Now this is something that Accuro can customize. You can customize it yourself using the different functions of Accuro, where you can, for example, have a default office schedule. You can have a flu clinic schedule or a vacation where the office might be closed. So if we choose, for example, a default office schedule, you will see many things color-coded and highlighted. For example, from 12 to 12:45 or to 1 o'clock, we have lunch. Therefore, the office is closed and we cannot book any patients during this time. And hence, if there is a blocking here, therefore you can't choose to book any patients. We have a CPX, which is a full examination. There is a new patient that can be booked during that time. Urgent appointments can be booked during this time, as well as the AM periods. The doctor has a meeting from 8 to 8:15, from 8 to 8:30, because again, there is 2 lines, so therefore it is 2 15-minute, therefore 30 minutes. So this is a default that you can use. So perhaps the doctor says, Mondays, I have this schedule. This is how I run the office. So therefore, you know that Dr. Zargar will only look at urgent appointments during this time and this time. So when someone calls, for example, as a new patient, we can only book them during this time. So this is an example. Now let's remove this template, which we would just say remove template, and it would bring it back to the default setting. Another thing I also wanted to show, if we right click again, we have the multi-day mode, the full week, business days, and the day of the week that you can choose. If you would like to have the full week, you will see that under this doctor, Sana Zargar, you will have from Sunday all the way to Saturday, the full week. I prefer, it's just a personal preference, but I prefer the 1 day. So I would just look at the Sunday. So let's delete those ones and just look at today's date, which is Sunday. Okay. And single day mode, Sunday, there we go. So this is an example of how we would introduce or how we would showcase the provider or the multiple providers, as well as how we would look at it per day or per week or however we prefer. Something else that I also wanted to show you within this video is the day sheet. If you look at this little icon, it looks like a printer. It is a printer icon. This symbol is our day sheet. Now, there is no schedules in today's day to print a day sheet. Therefore, that is why we get this comment here. The document has no pages. That is fine. So what I will do is once we have some bookings, I will print a day sheet for you and discuss that further. But just note that the day sheet is located at this little printer icon. So let's proceed to John Smith. Let's go back to John. He requires an appointment. So he calls and he would like to come in today. Let's just pretend today, Sunday, we are open, and he is going to come in for 10:15. And John Smith is a brand new patient to our clinic. He is a diabetic patient and he is coming in for his annual diabetic appointment, and he wants to speak about his diabetes. Something else that he's noted to you over the phone is that he will bring his own diabetic kit with him to ask some questions to the doctor. So we booked John into the 10:15 slot. Now, how do we do that? There are multiple ways. An easy way that I like to do is just click on the white area here and do not let go. So if we click and drag over up to 10:15, this little screen pops up. This is now the appointment details that we need to fill in. So we need to make sure that John's doctor is Santa Zargar. If we have confirmed his appointment, we can click that off. If he has actually arrived and he's right here in front of us, we can also click arrived. Now the appointment day, we're going to confirm that this information is correct. He's coming in for 10:15, and we will decide how long his appointment should be based on how the doctor prefers or how the clinic prefers to proceed with that. So for a diabetic, we would usually proceed with either 15 or 30 minutes. Now, since John Smith is a brand new patient, it does take time for Dr. Zargar to go through John's information and to interview him to see if there's any underlying causes, family history, so on and so forth. So as a new patient, we might need more time to discuss things with John. So perhaps we want to make 45 or even an hour appointment. Let's say, for example, we make the 60-minute, 1-hour appointment. Next, referred by and other providers. We do not need to provide these or fill them in. However, in some cases, John might have been referred to Dr. Zargar by another doctor, and this is where we would fill that in. Examination room, depending on your clinic, you might need to fill this out or you may not need to. For simplicity's sake, we will leave this blank. We have the type reason. These are very important drop downs where we need to fill in. So with my classes, I always say type, reason, notes. And every student always remembers this. Type, reason, notes. Type, reason, notes, they are 3 things that we should definitely look at filling out. Type is the type of appointment that we are making. Is it a consultation, an annual physical exam, diabetic, and the list goes on. Now, with Accuro, you can also add some other drop-down icons or you can add to this list if you request to. However, from this list, we will choose a diabetic annual for John. His reason, diabetes. And we will just go through this and look for the diabetes. There we go. Now, the location, we do not need to fill this out. It is just the doctor's office as default. Priority, he's a normal patient. It's not urgent at this time. And the insurer, 90% of the time, it will be OHIP, but depending on the situation, we will pick accordingly. Now, notes. Notes, I strongly encourage students to fill in. Why? Because whatever we fill in the note section will be what shows on the calendar, on the scheduler. So all of this information will not show on the scheduling. It will show on the day sheet that we print for the doctor. However, it will not show here because it will be too much information on there. And so therefore, if we want to make a note of something, we might say that John Smith is a new patient and it just says diabetes, something to the point where when another MOA or the doctor quickly looks at the scheduler, he or she will see that John Smith, diabetes, is a brand new patient. That's more than enough information. So for example, we can say new patient, and we can also say diabetes. Now, pop-up is also something very important. However, it's not always used. Pop-ups are used when, for example, whenever we type in John Smith's name, a pop-up comes up, a little alert. It doesn't matter who takes a look at John Smith's file or when it is, what appointment, but whenever John Smith comes up, the pop-up also comes up. Now, this is important for urgent matters. For example, allergic to bees, something that is very important for everyone to know, or perhaps allergic to insulin, something that the entire staff and the healthcare professionals should know about John. We can also include here in the notes section that John will be bringing his own diabetic kit with him. There we go. So very simple and to the point. And now we can press OK. Oh, just we can keep this because I had already made another appointment for John. And there we go. So John has come in, will be coming in for a 1-hour appointment. He's a new patient. Diabetes, will bring own kit at 10:15 for 60 minutes. Now again, because we had a pop-up that John is allergic to bees, we must acknowledge this pop-up before we can proceed. So we will say, okay. And there we go. And this little box here means that we have confirmed John's appointment. And another little green box would appear here if we had if he had already arrived into the clinic. Now, let's say John Smith has now arrived at the clinic. What we can do is we can right-click onto his appointment right here, and we can also say arrived. And there we go. There's that green box. There are other options such as no show, no charge, many other different options. You can also copy the appointment and paste it on another day. You can cut it. You can also delete the appointment. And what else should we? So if you hit cancel appointment, it will ask you, John Smith will be removed from traffic manager. The appointment is canceled. Okay. Now, there are two options. Would you like to cancel the appointment or would you like to delete the appointment? These are two different things. At the end of the day, John Smith will be deleted from here. However, canceling appointment would mean that John Smith has requested himself to cancel it, and there might be a service charge depending on the cancellation scheduling procedure at that clinic. However, delete appointment may be because the MOA made an error, and so therefore it has nothing to do with the patient, but the MOA has proposed that delete appointment request. And so if we press OK, this appointment for John Smith will be deleted. But for now, I will cancel that. So here we have John Smith and we have booked him an appointment. Again, in summary, we make sure that we are on the correct date with the correct provider and we choose the correct time. For a very simple way is that we just click and we drag over to whichever time slot that we require the patient to come in. Again, another box appears where now we will include the patient's appointment details, the type, reason, and the notes, and if a pop-up if required. So this is how we would schedule a patient in. Now let's for example say it is a reoccurring patient, a patient that has been here before. So let's say his last name or her last name is Choice. When we press, sorry, 1 second. So when we click Choice as the last name, comma, we will see many different patients with the last name Choice. And let's just pick Alex. Alex will come in for an appointment. He's been here before and now he needs another appointment. So when we click Alex, we have all of his demographic information. And here, his OHIP card is actually green, which tells us this is a true OHIP card number. Again, we will click and drag, and Alex will be coming in at 2 p.m. As we let go, another box will appear where we will put in Alex's appointment details, provider, and if we wish to fill in that part, the date, the time he's coming in for. This time it is for 15 minutes. The reason he might be coming in is because of mental health, for example, and education. So we're educating Alex on the topic of mental health and discussing that. We might not have any pop-up notes. However, under notes again, we might want to say something about Alex. So for example, we might say mental health. Okay, and we press OK. Now Alex will be coming in for mental health. That is the reason he is coming in. If for whatever reason you need to go back to one of the appointments, we will just double click. We need to acknowledge the pop-up that appears for John Smith. And once we said okay, the patient appointment details will pop up, and we could, for example, delete something that we had written. And now we press OK, and it will adjust. Again, we need to acknowledge the pop-up. And so this is an example of how to book patients into the scheduling system. Now, if we need to go to the next day, we can do so. On Monday here, Monday, November 23rd, we already have several patients booked. And Dr. Santa Zargar also has a lunch between 12 to 12:30 and a meeting from 1:30 till 2. From 1:30 till 2:15. She also has a meeting. Now this meeting, again, we cannot schedule anything because it is already blocked off. Lunch as well, it is blocked off. But you'll notice a difference between the lunch and the meeting. The meeting is a full group block, while the lunch is a single block. It's into two singles. The reason an MOA might do this, depending on the doctor as well, is because this meeting cannot be interrupted. This meeting will happen. However, the lunch, depending on the emergency of the clinic, if a patient comes in with an emergency, the MOA can easily go in and delete one of the lunches and continue with booking an emergency patient, if the doctor also agrees. However, if the lunch was in a full block, like very similar to the meeting, therefore we could not take one of the time slots and insert a patient. We would rather have to delete the entire lunch, and that would cause a little more work. And so therefore, if we do it into singles, it is much easier to delete each if we needed to insert a patient. Now, how do we insert a lunch or a meeting? For example, let's say from 3 to 3:30, there is a meeting. We will right click and you will see suggestion templates. You will see urgent appointment, OR, office is closed, new patient, lunch, meeting. So if there's a meeting, there we go. We had just booked it for 3 to 3:15. Now, if we need to book for, I'm going to delete this. Oh, actually, let's book it for a lunch here. So I'm going to hold my shift button on the keyboard and highlight 2 blocks or 2 rows, and therefore right click, suggestion templates, and lunch. Or we could insert a break since it's in the afternoon. So if we insert a break, it will ask us, would you like to do a group or a single line? Again, this is a single line, this is a group. And let's just say a single line. And there we go. Dr. Zargar has a break, 2 breaks, 2 15-minute breaks right here. And so this is for a schedule for tomorrow, Monday, November 23rd. Now, I like to prepare a day sheet for the doctor to make sure that she has a day sheet available on her desk for Monday morning to see what patients will be coming in. Now, a day sheet is very important, and you will be learning about this, that a day sheet has multiple purposes. It not only gives them a quick schedule of who will be coming in for that day, but it will also give them an area where they can write notes in, or perhaps billing codes for each patient. And this day sheet may be returned back to the MOA for the MOA to start billing claims for each patient at the end of the day. So in order to print this day sheet for the doctor, we will go to the day sheet icon. And there we go, there's a day sheet. And I'm just going to zoom in so we can all see clearly. It shows that we have booked 4 appointments for the day sheet of Monday, November 23rd, and the provider name is at the top. We also have the start of the appointment, the length of the appointment, 15, 60, 30, or 15 minutes, the type, and the notes. So here we have Devon Choice and John Smith and so on and so forth as our patients. We have their birthdays, their OHIP card numbers, their telephone number, as well as their file number in our database, and the reason and the type that they're coming in for this appointment. And other information might include their family doctor's name, and this is the doctor's practitioner number, as well as maybe a referred by doctor, which is blank. They were not referred by anyone. So each appointment has their demographic information as well as their scheduling information. So therefore, the doctor will know who will be coming in and for what duration, for what reason. Now, again, as mentioned, we can make some notes here. The doctor may make some notes. They may also include the billing number and the diagnosis for that particular patient. And this area, we will learn in the next video about how to bill patients. So we will use the billing codes that the doctor provides here or any notes in order to include into the patient's chart, to upload into the patient's encounter file, and to also bill the patient. So this is a day sheet where we will print this day sheet at our